Well, I've been cooped up for weeks because of COVID-19 and the weather's been terrible. Finally, a bit of sun. Get out. Well, what about the sun and this coronavirus? I know there's all kinds of talk about this, about sunlight destroying the virus, and there is something to that. Sunlight, of course, is composed of many different wavelengths, and it includes the ultraviolet part of the spectrum. This we don't see. Our eyes are not sensitive to it. Our skin, for example, is sensitive. This is what causes sunburn. And we know that sunburn can have some pretty tragic consequences because some wavelengths of ultraviolet light are energetic enough to destroy tissue. Well, they are also energetic enough to destroy the virus. On the other hand, I don't think we have to worry about the virus being in the air. No, I'm not inhaling any virus here. Maybe if my cameraman were sneezing and coughing in my face, that would be a concern. But he's not doing that. So no, I don't think that there's an issue here. However, there is an issue about the virus being found in surfaces. You know, if someone coughs on a surface, someone else touches it, touches their face, yes. So what about these ultraviolet wands which are being sold in order to disinfect surfaces? Do they work? Well, yeah, they do work because they produce ultraviolet C, which is very short wavelength ultraviolet light. That has a lot of energy. It can indeed destroy the virus. However, it needs sufficient time to do that. So when you're using one of these wands, you have to run it over the surface very, very slowly. It's not a convenient way to do this. And also you have to realize that it only hits viruses that the light encounters. On a surface that is uneven, there are nooks and crannies and shadows, and the virus can hide in those nooks and crannies and escape the light. So I don't think it's a great way to disinfect. I think using disinfectant on a cloth is a much better way to go. But what about having ultraviolet lights in places like train stations, airports, etc., to disinfect? Well, of course, the trouble is that ultraviolet C, that is the very small wavelength rays that would be needed, are also damaging to the skin. But interestingly enough, there is some research carried out in New York by Dr. Brenner, who is an expert in this field, who has found that one specific wavelength, 222 nanometers, exactly that wavelength, will destroy a virus but will not harm human skin. So they are now working on these lamps, which will release only that one wavelength and trying to get FDA approval for it. These are going to be expensive to produce because of the significant filtering system that is needed to yield only that one wavelength. Finally, there's one other option, and this takes us back to the 1940s and 1950s. When, believe it or not, to treat various kinds of diseases like polio, tuberculosis, septicemia, which is bacterial poisoning of the blood, they would draw some blood out of the human body, expose it to ultraviolet light, and re-infuse it into the body, having supposedly killed the bacteria and the viruses. And the interesting aspect of this is that they didn't have to remove all the blood from the body. They just removed about 7% of it, treated it, put it back in, and they claimed results. This technology has basically been forgotten because of the advent of antibiotics. But you know what? Interestingly enough, maybe it's time to look at history again. Maybe it's time to go back and have a look at the cure that time forgot.